when COVID first started, we almost were like ready for it. We didn't really understand what was coming, but I think, we prepared all of these, carts, and we had all of our PPE, and we had, ongoing daily education out to the staff. And we seemed like we were ready for whatever was coming, which is, like a true emergency nurse. And then you can just see as the past 2 years have just gone on, I can see it every single day. The nurses are just so tired. I think they're sick of the ongoing changes. It's getting better and then it gets worse again. So I can really see their compassion fatigue, hitting in. I think honestly, they're just tired and they're over it. They're ready for it to move on and get back to whatever normal is now.
One day we had over 450 employees out, either related to a positive COVID test or were being quarantined, waiting for those test results. And that was the impact of hospital operations. And on that day, we made a decision we've got to continue to take care of our patients. We've got to continue to take care of the community. But at that point, we needed to support the staff at the front line. As Alyssa said, you could see the compassion fatigue. You could see nurses, they were tired. You could see it in their eyes. And at that point, we felt like we couldn't ask for them to do any more than what they currently were doing. And so we asked 110 non-clinical nurses that were in our other departments, such as our IT, in our nursing education, and we asked them to give us 2 weeks of 24 hours a week of at the bedside care. So we basically reassigned our non-clinical nurses to clinical care. We're to a point now that we can, we offer an hourly bonus for nurses to pick up extra. And it becomes a point where it doesn't matter how much money you give them, they are just too tired. And they're just not coming in to work because they need time off. They need downtime.
They get angry. They yell. A lot of the triage nurses, we have great case managers and social workers in the emergency department that try to help everybody. But sometimes you just can't. So I know that our nurses are facing that. And once you get that every day for 2 years, you get to a point where you want to yell back, you get angry, and they do a great job to where they try to keep it all in, but it just happens. COVID is dear to me. My grandfather passed away of COVID. So that's my own personal story. I was dealing with working in the emergency department, and he was fighting for his life here on 7 West.
It's looking at the way we deliver care and doing it in a different manner. And doing it in different models of care. I think it's also, I just keep going back to focusing on the well-being of our staff.
We're looking at how can we get creative. We're bringing on paramedics to our team, which we haven't done, to actually just be support for the nurses. And basically taking care of our own nurses. So looking at, retention and burnout, and 2 of our nurses are going to get a group together so they can actually, I wouldn't say it's really a committee, but they're actually going to get nurses together to focus on just their own well-being, whether they do art therapy or they, do something together that they can just kind of get away from work. I think we do have to figure out how we can keep them motivated and keep them engaged and, wanting to come back every day. Cause that's that's hard right now. That's what we struggle with.